Hi, I'm Dr. Duke, and this is Run Smart New York. I'm with Caitlin, a local triathlete who's helping me out today, and this is part one of a mini-series on preventing Achilles tendonitis. All right, so let's get started. First of all, if you're not performing regular maintenance on your feet and on your shins and on your calves, then this session is absolutely for you. So, number one, what is the Achilles tendon? Caitlin, turn just a little sideways. The Achilles tendon is essentially a cord that attaches your calf to your heel. Now, when people say I have Achilles tendonitis, what they don't realize is not just an inflammation to the tendon. Usually, there's some tearing going on there. And that's when you're going to feel like some bumps on the inner part of that Achilles tendon, never on the outer, always like on that inner part there. Now, what causes Achilles tendonitis and some of those little frays and rips and tears? Usually, very tight calves, and that's what she has here. And there's also something really super tight, it's called the posterior compartment. It lies underneath the calf and goes all the way down to the bottom of your feet. Another thing that causes Achilles tendonitis, a really big one, is hyperpronation, or a fallen arch where your foot collapses in. So it's almost like it collapses this way. It also causes shin splints, but man, it wreaks havoc on the Achilles tendon. So that's another thing that causes this. You know what else causes Achilles tendonitis?
What?
Mismanagement. People who are told to heat it and people who are told to stretch it. So there's a lot of people out there who do this. They'll go over to like a step and then they'll really aggressively press down and bounce. When you do this, this just tears and strains on that Achilles tendon. Plus, then they bend their knee. Oh, and that's even uglier. So please do yourself a favor, stop those two things, especially if you think you're helping your Achilles tendon. All right, so why don't we focus on flexibility? So one of the things I want to do, how do we stretch the calves and the hamstrings? Why don't we first start with a standing calf stretch. Go ahead, put your foot out. And now just arch down, try to grab that foot, and you should be feeling like a nice burning sensation on the back of that calf, right in that area. Excellent, stand up. How about cross your ankles over each other? Excellent, and now flex your foot up in the air, stretch down again. When she pulls up, this is another way it gets the peroneals and the back of the calf again. Now, lay on your back for me. You see, you can't just stretch your calves, you gotta do the whole kinetic chain. The whole kinetic chain means all the way up from the bottom of your foot to your pelvis. So grab that rope. If you don't have a rope, please go get a rope or just use something else. And now pull your leg all the way up, and that gets the hamstrings. Then the hamstrings are three different muscles, so you can't just go in one direction. Take your leg and cross over to the side, Caitlin. And now pull it up towards you. She's not very flexible, is she? This is perfect for you. You should feel it on the outer part right over here. That's getting the peroneals, and also it's getting the lateral hamstrings. Then come back up again and come on all the way up to the side. You want to get the semitendinosus and membranosus. Those are the medial or inner hamstring muscles. Pull it up higher, come on, flex your foot. That's a nice way to kind of get into the hamstrings. Now, another problem with Achilles tendonitis are people who overstride. Overstriding is usually because the hamstrings get maybe too loose, but the hip flexors are so short and tight that they make you overstride. So I want to stretch out the front of the hip. See, it's never just about the Achilles. You got to work the whole way up. So get into a nice lunge. Use this leg all the way forward. Nice. Now, kind of note, just focus a little arch in your back. Try to grab your back foot. That's it. Try to lunge a little bit more forward. And that gets an excellent stretch to the front of the quads. And you remember, the quads attach all the way up on top of that pelvic rim called the iliac crest. Keep on lunging forward, and it's a two-joint muscle, so you want to get it in the front of the hip and also on the bottom of the leg. Now, come out of that stretch. A lot of people also wear flats, meaning like flip-flops. Please stop wearing flip-flops. When you use and wear flip-flops, your big toe is grabbing the flip-flop, trying to keep it on. It'll cause plantar fasciitis, and it'll also cause that Achilles tendon to grab and get really short and tight. All right, join me for part 2 when I show you how to create strength to the arch of your foot and help prevent this injury from happening to you. I'm Dr. Duke, and this is Run Smart, New York.